Hello, I'm Robert, a fact checker and science blogger and helping people who are scared of many things. And I'm just going to talk about 4 important things that the people who come to me for help don't know about COVID. And my background is just that I follow what the World Health Organization say. And then I just say, this is what the CDC say, the US, UK say, what the World Health Organization say. And I'm astonished that most of them don't know these 4 things. So most of them don't know that if you have trouble breathing, that's an absolute emergency if you've got COVID. You should ring up your emergency line straight away, or your fast helpline, whatever, if you've got a dedicated COVID-19 helpline. And then they will talk to you over the phone, and they may very well send someone around with an ambulance straight away. Now, the reason isn't that you're going to die on the spot. The reason is that if they're found out through long experience, of months of experience now, that if you start treating someone as soon as they have breathlessness, it greatly improves their outcome. So they want you to get you to hospital straight away if your oxygen levels are going down. You may remember that when his oxygen levels went down, he was whisked straight to the military hospital. And everyone, it should be like that. Even if it just drops a little bit, just drops down to 96% or something, off you go. And you should get one of these oxygen monitors if you've developed and be tested for COVID-19. And so many people don't know that. And these other things, these are all emergency warning signs. This is the CDC, the US CDC. If you have trouble breathing, and that means it's not like a panic attack. So some people I help have frequent panic attacks. So if you have them, you know what it feels like. And your heart beating and breathing very fast and so on. But it's over quite quickly. But this is like just doing normal activities. Like you just going upstairs or some normal activity and you just get breathless. Or you're just lying in bed and breathless and it goes on. And it's not a panic attack. It's not over quickly like a panic attack. Then ring up emergency straight away. And the thing is, many people, it is actually dangerous if you don't do that. So many people try to home treat lack of oxygen in their blood. There's no home remedy. Your home remedies can relieve the symptoms. You may feel better. You may be able to breathe more easily. But the underlying problem, that your blood is having less oxygen than it needs, has not gone away. And it's a special thing of COVID that quite often the oxygen levels go way down and yet people feel no discomfort. They sometimes don't even have trouble breathing. That's why it also talks about these other things, new confusion or inability to arouse bluish lips or face. To get people's lips and face go blue, and yet they're just breathing normally and they're totally unaware that they have a lack of oxygen in their blood because of something to do with the way it interacts with the lining between your lungs and your blood supply. Whatever the reason, it just doesn't give you the warning signs sometimes. And really quite experienced people who think they understand medicine can really be caught out by this. And a fair number of people have died at home trying to home treat a lack of oxygen. You need a ventilator or these breathing things they have. You need an oxygen supply. You need medical training. You can't just buy an oxygen kit off the internet and hope to treat your lack of oxygen that way. You've got to be able to monitor the oxygen levels, monitor the symptoms, and treat the patient appropriately. And they have to have oxygen overnight while they're sleeping. So please do not try to home treat lack of oxygen. Now, if you look at the US CDC, they say the symptoms of COVID-19, they say when you seek emergency attention, it's in blue, and that's what I did a screenshot of there. Now, if you go to the United Kingdom, and it's often people in the United Kingdom who don't know this, all they say is use NHS 111 if you're worried about your symptoms, you're not sure what to do. And people in the United Kingdom are quite often quite reticent. They don't want to bother a doctor. So they start feeling a bit breathless. Say, oh, I can deal with that. I'm not worried about this. And then a few days later they've died. So you've got to be very... I think it's negligent actually in a way almost. So I shouldn't really say that, but I can't fathom why the NHS hasn't put something like that on their symptoms of COVID page. It's so... it's been, the United Kingdom's been just so not very good at communicating. But if you get through to the 111, you say, I'm breathless, then they will send someone out immediately. If you explain what's going on and they decide it seems you've got lack of oxygen, they will send an ambulance out. But for some reason, so they know this, but there's some miscommunication. The NHS website doesn't make it clear, and in practice, most of the people in the United Kingdom who contact me who are just worried, and they're just worried about COVID-19, and then they'll say, I've got COVID or my friend's got COVID, and I say, this is what you've got to do. You watch out for that, and they don't know. They might say that their friend with COVID has experienced breathlessness, and they'll say, go and contact 111 straight away. So this is my number one thing, that it's saving lives. They're not going to feel that you're troubling them. If you've got breathlessness, just ring, if you're in the UK, ring NHS 111 straight away if you have breathlessness connected with COVID, and get yourself one of those oxygen monitors you can put on your finger, and if the oxygen level drops down, then again bring them up, and they'll probably send an ambulance round, and that hugely reduces your risk of dying. So that's number one. The four of these things that if you listen to the World Health Organization, then over and over they're saying these things, but most people don't listen to them. So, or if you go and look at the CDC website, it says much better than the UK website on this topic. So I'll upload this, and then I've got another three of them. There's to do with the isolation and quarantine and physical distancing. And so most of the people who contact me do not understand why you do the physical distancing really. They don't understand why you do isolation. They don't understand the need to isolate away from their own household. They don't understand why you do quarantine. So those are very essential, central things that most people in the UK don't seem to know.